The following is a review of the first online exam for Principles of Cardiac Sonography 2. The exam occurred in week 7. Overall, students performed very well. This review will briefly cover some of the questions that proved more difficult. Question 3. When the cardiac output is insufficient to meet the body's needs, it may result in which of the following? Insufficient blood flow to a region can result in any of the first 3 answers. The most correct answer for this question, which asks about insufficient cardiac output to meet the body's needs, is D, heart failure. Question 8. In ultrasound imaging, what best describes lateral resolution was the question. This apical 4-chamber 2D image helps to illustrate the answer. As you can see, there is more lateral smearing at the bottom of the image, indicating that lateral resolution varies with depth. Question 11. Temporal resolution can be improved by which of the following? As the number of pulses required for each line of sight reduces the frame rate, temporal resolution can be improved by decreasing the number of pulses required to create each image. Question 14. Question 14 asked you to select the answer that best indicates the echocardiographic measurements expected from a patient with restrictive cardiomyopathy. In a patient with restrictive cardiomyopathy, you expect to see high velocity E waves, low E prime velocities, and an enlarged left atrial volume. So the answer is D. Question 16 asked about the cause of shadowing artifact. Shadowing occurs when attenuation is very high at a certain point, beyond which echoes are very low in strength and there's a shadow. As such, answer A, higher attenuation than other tissues, is the cause. Question 19. Compared with standard transcutaneous imaging, the use of invasive probes gives which of the following? In the majority of cases, invasive probes, such as transesophageal probes used to image the heart, give better resolution and allow images to be acquired at higher frame rates. The answer is B. A review of the second Principles of Cardiac Sonography 2 online exam from week 13. Once again, most students performed very well. This review will briefly cover some questions that proved more difficult. Question 7. Compared with patient exposure levels in grayscale imaging, exposure levels in pulse Doppler are what? Exposure levels in pulse wave Doppler are higher than with 2D, so only A or C can be correct. The ultrasound frequency emitted by the machine are the same for both modalities, therefore the answer is A. Exposure levels are higher to help compensate for poor scattering of ultrasound by blood. Question 10 asked how harmonic imaging improves contrast resolution. harmonic imaging does not reduce the field of view or increase frame rate. The transmit frequency used in harmonic imaging is not increased, although received frequency is the second harmonic. The real advantage of harmonic imaging, and the answer to the question, is that harmonic imaging has fewer artifacts. Question 11. Valve stenosis due to calcific degeneration is not likely to result in which of the following? Valvular stenosis does result in the first three: reduced orifice area, obstruction to flow, and reduced leaflet mobility. What calcific degeneration doesn't do, as opposed to rheumatic disease, is cause commissural fusion. Question 12 asked for the abbreviations related to intensity values to be listed in descending order, that is, from most intense to least intense. The question refers to spatial and temporal intensity values. As the upper image from the physics text indicates here, the temporal peak values are greater than the temporal average values. So the possible answers can be narrowed down to either A or D. And as the lower image indicates, the spatial peak is greater than the spatial average. The correct answer, therefore, is A.